Good morning and Happy New Year. It is the 2nd of January 2025, and my New Year's resolution is to actually create a new channel on YouTube where I would hope to actually help you guys understand simple conditions on how to manage it for your health, for your own as well as your family. This is my first post, so you have to be tolerant with me at the moment. I'm quite new at this, and I would like to call it KISS Medicine. Keep it super simple medicine. I haven't seen anything like this on YouTube or TikTok or something like that, so hopefully it will help to some degree with you guys managing your health as well as your family's health. So in these posts, I'm hoping to cover simple things, common things, simple things that you can actually manage your health with and your family, and perhaps later on to make you understand various medical conditions, to keep it simple, and when to get help and when to manage things at home. This is not a video which is supposed to be replacing your doctor. You must keep communication with your doctor whenever possible, and you've got to follow your gut feeling. If you feel that things aren't working out, and whatever hints I give you in this doesn't really feel like, okay, it's working at the moment, because it won't always work, then you need to go and seek your doctor's help. At the end of the day, you've got to follow your gut feeling. If you feel this isn't working, I'm worried about my child, I'm worried about my wife, I'm worried about myself, then you must seek your help either from your doctor or you go to the emergency department. So a little bit of a background for myself. I've been a doctor for 37 years now. So I graduated in 1988. And I also have been a chiropractor, which I know you probably feel it's a funny combination, for 18 years now. So to begin with, what I would like to discuss today is a very common issue of fever. What do you do with fever? And how do you deal with it? So to start off with, fever is actually quite a normal symptom that your body has when it's not well. Your normal body temperature is anywhere between 36 degrees Celsius and 37 degrees Celsius. This generally applies to everyone, from babies all the way to elderlies. So what would you consider a low-grade fever? Is somebody with a fever of between 37.1 and about 37.5 degrees Celsius. A high fever is anything more than 38 degrees Celsius. A very high fever is anything over 40 degrees Celsius, and this can be dangerous also. So what do you do when you get a fever? Well, a fever is a normal body reaction to when somebody has usually an infection of some kind, whether it's viral infection, bacterial infection. There are other causes of fevers that we won't cover here. We are sticking with common causes of fever, which is usually infections. So I like to tell my patients that common things occur commonly. So don't look for weird things that causes your fever. So chances are, if you get a fever, you're going to have a viral infection. That's the most common one. The first 2-3 days will be viral infection. And if you find that things don't resolve so quickly, you might develop other symptoms. You probably have a bacterial infection of some sort. So let's deal with a common way to deal with a fever. So when you get a fever, you can actually treat fevers with a couple of methods. You can do medication, or you can actually do fevers treatment with changing your environment. So the easiest thing, of course, when you get a fever is, okay, take some Panadol or take some ibuprofen. Yes, they're the most easiest thing to actually do. And that's probably what I would advise you to do as well. So there are two main medications that are actually used to use fever, for fever management, I mean. Paracetamol is the most common one. So whatever paracetamol formulation that you've actually got, and depending on what country that you're in, you probably have Panadol, or you might have Tylenol, something like that. So look at the bottle, look at the pack, because depending on what you're actually using for adults or kids, the recommendation of doses are different. So something with paracetamol, Panadol, Tylenol, you can use every 4 hours. So you've got to have some response though. If you find that you don't get a response within half an hour to an hour, it's probably not working on that recommended dose. So what do? well, you can add on the second medication, which is ibuprofen. You can use them together. They work totally differently from each other. So ibuprofen, depending on the dose that you've actually got, again, look at the bottle, look at the box, and see what the recommended dose for your age. Then you can actually use paracetamol first, and then maybe half an hour to an hour later, add on some ibuprofen, see what happens. If it works, great, then you can keep that going. How often can you take ibuprofen? Usually every 6 to 8 hours, you can actually take an ibuprofen dose. The paracetamol every 4 hours or so. So there's a maximum dose that you can have in a day. Don't exceed that. If you exceed that, then you really need some medical advice, okay? Now, if it doesn't work, if you find that your fever doesn't drop within a period of half an hour to an hour and it just keeps getting worse, then you need to seek medical advice. Or you can also try changing your environment as an addition. So when I mean changing your environment, okay, you've got somebody who's really hot, they are feeling pardon me, cold, they have chills, you want to cool down their temperature, you take the thermometer, measure it. The ideal situation is put it under your tongue and have a look and see what the temperature is. Pardon me. Now, if your fever is really, really high, then you really need to take some clothing off. But you need to be in a room where there's no breeze, there is no wind. You shouldn't be putting a fan on, because any air movements that goes onto somebody with a fever, they might start feeling cold. And if they shiver, the action of shivering would actually increase your body temperature and the fever will get worse. So what you do, have them in a nice calm room, about 24 to 26 degrees is ideal. And then you take the clothing off, have minimal amount of clothing, underwear, very thin t-shirt or something. If need be, take that off also. And if the temperature remains high, start to get some warm water. You use what's called tepid sponging. You put them on the body. So wet cloth, wet rag, dab all over. This allows the water to evaporate. With the water evaporate, it'll take away heat and it'll cool the temperature down. You don't use cold water on the body. The only place that you actually use cold water or cold compresses are on the head to cool the head down. If the head heats up too much with temperature, with a fever, you're risking a seizure of some sort. So you want to cool the head. Keep a cold compress on the head at all times. And for the rest of the body, just keep doing the tepid sponging. And usually within about a period of 30 minutes or so, things should start improving. Your temperature should go down. Measure your temperature every 10 minutes. Every 10 minutes, take your temperature, have a look. Is it working? Is it coming down? If the fever is coming down with the medication and the cooling down in the stable environment, it's working. Then you can keep going. You just maintain that all the time. If you find that it's not working, so despite the physical changes, despite using the medication, you go for 30 minutes to an hour, not working, you need some medical advice. Whether you go to emergency room or you've got to contact your GP, your doctor, and find out, look, can I get an appointment? Because there may be something else going on. Of course, there may be rashes, there may be all sorts of stuff, and you worry about things which are more dangerous like meningitis, but we won't cover that here. Any rashes that you actually have, I think it may be worthwhile having medical advice and have a look and see what's actually going on. What else? I think that pretty well covers everything. And at the end of the day, if your gut feeling says this is not working, this is not going, something more serious may be going on, then I think you should stop and seek further medical help. All right? So follow your gut feeling, see how we go, and if there's any issues at all, just go straight to emergency. Thank you.